Hi everyone, thanks for joining us. Today we're going to be discussing about how sitting adversely affects your health. Now, most people realize that, again, sitting is not very conducive, right, for your body. In this case here, we're talking about the functionality of your joints. I'm going to be talking a little bit more, I should say, about just rather than talking about the functionality of your joints. In this case here, we're talking about your spine because I'm a chiropractor, but also look at other joints too, like your hips, your knees, and so on. But we're also going to be talking about what are some of the complications that arises with prolonged sitting and what you can do if you don't have a choice but to sit with your job. Again, it's one of those things that, again, the reality is that we all can't just get up and walk away from our job, right? So let's help everybody to figure out a way to manage the sitting stress that is placed upon your body. So let's talk about some of the stress that is put on our body physically when we sit. Now, when you're sitting, most people realize that sitting puts a lot of pressure on your low back. It actually puts too much pressure on your low back because your foundation goes from your ankles to your knees to your hips. Now it goes right directly to your tailbone and to your low back when you're sitting. So now your foundation, instead of being your feet, has now become your tailbone and your low back. So guess what? All the pressure comes down to. Now that's not even taking into account of people bending forward slightly more or having bad posture, like rounding the shoulder, rounding the back, which will put more stress on the discs. So hence, guess what happens to your discs over time? They start to wear, and then they're gonna herniate or they're gonna bulge, and you're gonna have a whole host of problems further down the road rather than just bad posture, right? So that's the physical manifestation that can happen with the low back. Now, when we're talking about the hips area, sitting sedentary in a sedentary position is horrible for your hips. It's probably the most, in my opinion, in a way. I don't think there's a research out there that can, accumulate for all the people that are sitting. But I think that's probably one of the most effective way to have a hip replacement is to sit. It's because why? Your hips have become lazy, right? They have become non-functional or dysfunctional. When you get up, you're putting stress on them, and they're not used to it because they've been lazy for 5, 6, or 7 hours a day. And when you're putting stress on them, guess what happened? You're putting stress and irritating the cartilage, so then hence they have inflammation. So when the cartilage have inflammation, your body gets more spasm around your buttocks muscle, around the piriformis, and locks your hip even further. And now you have further inflammation because you have more stress, and then people limp, and then they're putting more stress on the joint, and you start to develop wear and tear on your cartilage. So that leads to bad joint capsule in the joints, which would then lead to what? Arthritis. And hence, when you get arthritis bad enough, you start to have growing pain, and when you start to have growing pain, when you're walking and you have a lot of arthritis or degeneration in your hip, guess what your surgeon tells you? You need to have a hip replacement, probably now or within a very short time frame of 1 to 3 years. Okay, I see that a lot with my patients because I deal with 65-year-old patients, 75-year-old patients, 80-year-old patients, quite a few of them have hip replacement. Okay, so one of the first thing that we notice a lot about these patients is that the ones who are very, very active, yes, they might have some wear and tear on the hips, with the exception of the few, like your major league players or your pro basketball players or your major or your golf pro that are putting really extreme stress on the hips. Those are the exceptions. Most everybody are not the exceptions, right? Most everybody are layman's people that have hip replacement. That's not from a lot of repetitive professional or competitive athletes. And these people here, they have hip wear and tear from being too sedentary. And that leads to more hip replacement than you can ever see, all right? So it's probably one of the most common surgery that we have. Thank goodness, surgeons, believe it or not, have a very good track record about replacing hips. But I don't recommend, trashing your hips now at 35, right, or 45, so you can get a hip replacement, right? Let's save it, because you're gonna be much more happier if you save it now by doing the proper things for it. So what are some of the proper things you can do for your low back and your hip from wearing out away from sitting? Every 30 minutes, 45 minutes, get up, walk around a little bit, just do a little stretch. One of my favorite stretch is the figure four stretch. Okay, all you do is you bend your knees. I'm sure you guys can see me or not, but we'll put a link on there on how to do a figure four stretch. But doing the figure four stretch, you can do over a chair, you can do it while you're staying up, to put stress on your hip joint. That helps them to limber that up, get some blood flows in there, and walk around, throw something away in the garbage, get a little drink, whatever it is. Making excuses to get up for 30 seconds, a minute, two here and there. Change position. The key is get up, move, change position. That's gonna help you much more than what you actually realize by sitting there. You're sitting there for prolonged periods, all you're gonna do is use the same muscle, but in the same stress in the same area, and hence it's gonna create wear and tear on that particular joint. When it comes to the low back, one of the most simplest thing is to get up and do what I call a back extension, right? Just slowly bring this back. You don't have to go way back, just arch your back, get that curvature in your low back by arching your back more. It's kind of like doing a bridging while you're standing up, okay? So what that does is that it contracts the muscle in the back and it helps to bring blood flows into the area, loosen everything up on you, because especially when you're sitting hunched forward and rounded on the chair on the computer. So hopefully, those things that you can do, just a little bit snippets in there, is going to help to limber your low back, limber up your hips. Now, on a visceral, or for your overall health, right, or for your organs like your heart and so on. So, sitting is probably one of the worst things we can do. Why? Because we're not moving around. So that's pretty much obvious. So, but besides that, the big thing is that the inability of you not moving, which will oftentimes will create, waking, okay? And that's probably the biggest factor that we all undergo, is that when we have a sedentary lifestyle, in this case here is having a sedentary job, you're not gonna burn much calories, so hence you're gonna gain weight. And if you have poor nutrition on top of that, and if you don't exercise, guess what happens? It's gonna affect you literally much more than the physical factor. It's gonna affect you on a visceral or organ level. That's going to affect how your heart function, leads to cardiovascular diseases, leads to weight gain, leads to high blood pressure, leading to diabetes. So those kind of things are, again, some of the much more pressing matters for me as a doctor, trying to help everybody to understand that sitting as a job, you have to take the precautionary things to do things outside of your workplace to contradict or to help to manifest or limit or low down the risk factor that you're putting your body into. So what are those things you need to do outside of your workplace? You need to find a activity, be it walking for 30, 40 minutes 4 or 5 times a week, or join the gym, going home and running or jogging for 10 to 15 minutes here and there. Whatever it is that makes you happy, that you're gonna be able to do it religiously, I don't care, okay? Sometimes we harp too much about different exercise that everybody needs to do, and join the gym, do this and stuff like that. I really don't, it doesn't matter. Raise your heart rate up, move and be mobile, okay? Life is motion, and if you remember that, it's gonna help you all throughout. Doesn't matter if it's your joints from your lower back, to your heart, or to your diabetes, it's gonna help you to survive and be much better down the road for further to help with aging gracefully. Thanks a lot for joining us. Please like our channel and please subscribe. If you guys have any questions, please let us know and we'll cover any topics that you want us to. Thank you.